for taking your time up this afternoon to contribute to our investigation. I'm delighted to see so many of you today as we talk about the very important topic of organ donation in the BMA community. The committee is concerned about the fact that people from the Black, Asian and ethnic minority communities face unfair challenges to organ donation, because we know that our BMA communities have higher rates of illness like diabetes, blood pressure, that can lead to organ damage and a need for organ donation. But we're also aware of the fact that people from our BMA communities are not coming forward as much as they should be to get on the organ register, and that people from the BMA community find it even more difficult than other members of the community to find an organ. So this is literally a matter of life and death for some people within the BMA community across London. We really want to understand what can be done to increase organ registration from the BMA community. We also want to raise awareness of this issue to help people better understand the need for organ donation, and also what can be done to prevent people from needing organ donation in the first place. We're honored that to have so many of you with direct experience coming here this afternoon and talk to us. And let me particularly welcome our colleague, Assembly Member Flo Eshimoli, who also is in the audience and will contribute from her own personal experience later on. So thank you, Flo, for making the effort coming this afternoon. And there are also people here who have received organ transplants and also want to share their stories with us. Living donors who have given a great gift of their organ to their loved ones and their family members play a huge role in this matter. And I know, particularly as a doctor, that for a donor, the operation that they need to go through is a much bigger operation than the recipient of their organ is, and they are making a huge contribution. And I know they make this because of the love and the affection they have for their family members, and that they do give the gift of life to their loved ones. So I want to give a big shout out to the live organ donors also. And the people from a wide range of areas of the community are supporting this drive of ours, and I want to welcome all of you to share your experiences with us and see how you have been helping the communities and raising the profile of this issue. I also want to encourage you to tweet and use the hashtag Assembly Health and also hashtag BME Donor. And a few housekeeping issues. We're not expecting a fire alarm. If it happens, it's for real. So please follow the directions of the staff members who will be guiding us how to leave the building. If you need to use the toilets, these are available outside the chamber. Just ask a member of staff to show them to you. If you would like to join the conversation at any point, please raise your hand and someone will bring you a microphone. And can I also please ask you to introduce yourselves before you speak so that we know who's addressing and from what perspective you'll be speaking from. And I also want to remind you that this meeting is being webcast and recorded. We also ask you to remember that lots of people want to speak, so please do try to be precise in your comments and keep your questions as brief as possible so we get as much opportunity of getting as many people involved in the conversation as possible. There are 5 sections to the discussion this afternoon. A member of the assemblies will each introduce each section of our finding of our reports, and also to lead on each section of the afternoon. We'll try to spend about 20 minutes on each section. We also have got 2 short breaks. This will give us a chance and there will also be a chance at the end to wrap up for any comments. And there's also more information in your delegate packs on your chairs. But do feel free to raise your hands whenever you want to join in, or even if a question hasn't been directed to you and you feel that you have a contribution to make, then please do so. The other thing is that this afternoon is learning exercise. Although we are the health committee, we are taking a very informal approach this afternoon, so be relaxed, enjoy the afternoon and we're really here to learn from you. We don't have the answers, we're looking for the answers, but the answers is amongst all of us collectively, and I think that's what the search is on this afternoon for. So I'll start to I'll start kick-off this afternoon. But before I do that, maybe I can ask the Assembly members who are here to introduce themselves. From Andrew?
Yes, I'm Andrew Boff. I'm a Conservative member of the London Assembly and a member of the Health Committee.
Hello, I'm Joanne McCartney. I'm a Labour member of the committee.
I'm Susan Hall. I'm a Conservative member of the committee.
This is not an empty chair. There will be a person there, his Assembly member Umesh Desai, who's a member of the Health Committee, but he has to go on some other urgent business, and he'll join us as soon as he can. So there will be someone in this chair also. But let me just start off this section, and I'm going to talk about the experience of the individuals. I want to talk about, invite people to share their personal experiences, either as recipients or donors of organs, living donors, and also people waiting to receive an organ. Let me just point to a key finding of our report, of a survey we did. 56% of people said they were willing to consider organ donation, and 28% were undecided. But only 1% of those people actually had signed up to become organ donor registers. And 62% of people in London who are waiting for an organ are from the BAME community. And so there's a big disparity between people who need organs and people who from the BAME community who are on the register. So I want to get an understanding of what the impact on individuals is, to share your experiences both as recipients and as donors and living donors, and also people who are still waiting to receive an organ yet. So let's start from that. I'll go and sit down to make it a bit more informal, right, rather than from the stage. So I look forward to hearing from you. Are there any people in the audience who have received an organ or are waiting for an organ? If you get a mic to please. The lady at the back, and then we'll come forward to you.
Hello, do I need to stand up? Hello, my name's Gillian King, and I'm on end-stage renal failure, and I've been on hemodialysis since December 2014, so about just over 4 years. I find that when you tell people that you're on dialysis, they think it's a cure for renal failure, which it's not. The only cure for renal failure is a transplant. So I was actually on the list before I started dialysis. My brother volunteered to be a live donor, but we were not a match. There's many tests, and I wasn't a match. So then I went onto the list. So I've been on the list for about 5 years, and the average waiting time for somebody like me is 5.5 years. And for a person of Caucasian, it's 18 months. So it's a big disparity. And I also stress that waiting time is average, so it could be up to 10 or 15 years. Life on dialysis is very, very difficult. I can't overestimate the disadvantages. It has an impact on all areas of my life, on my physical and mental well-being, on my family life, on my productivity, on my creativity, because I have to dialyze 3 times a week for up to 6 hours at a time, and that doesn't include travel time to the unit. So if you think of it as a part-time job where you don't have any time off or bank holidays and you don't get paid. It also has an impact on me financially because the treatment is really expensive. It has an impact on how it's delivered by the health service. And so, there's always sort of juggling by the health service about what's going to be provided and what's not going to be provided. Do they provide transport? Do they provide food during the 6 hours that they spend in the unit? And so all these have an impact on how the service is received. And as you stated, most of the people in these dialysis units are of colour, so that also affects the way the service is delivered. I actually wrote a paper on this issue regarding health literacy and the inequalities in the health service with my colleague Della, which was published in June. Paper's available online if anybody needs any more information. I can give that to you, but I only mention it because in that paper what I talk about as a solution to this problem is to empower communities so that information, and I think information is the most important thing for people who want to donate, for recipients, and for even people who are suffering from the disease, because kidney disease is very complicated and people who are suffering from it sometimes don't understand what's happening to them. And studies have shown that people receive this complicated health information much better from peers rather than from healthcare professionals. But at the moment, that facility is just not available. Where it's available, it's not very well disseminated, and it's just, you know, very patchy and disorganized. So one way that this area could improve, both in information to people who are going to donate and receive, and people on the list, is for this information to be more organized and disseminated within the community, so that people in the communities are speaking to people in their communities about what's needed.
Thank you for that. Gentleman in front of you.
Good afternoon. It's Zahid Bhatti. By profession, I'm an entrepreneur, but today I'm representing Global Kidney Foundation. Last September, it was, 5th year of my as a recipient of kidney. I've been on dialysis for 5 years. That was very hectic, as I agreed what she said. Very difficult time. But initially, after 2.5 years, my brother stepped in and he gave me his kidney. Due to certain reason, that was failed within few minutes or days, and then I have to go back on to dialysis. I was working at that time, and it's very difficult to maintain all the things, timing, 3 shifts, schedule, all the things. The thing and the gist for that is the patients actually need support from their families, from their friends. Although in clinics, hospitals, units, nurses, doctors are very helpful. They are giving best caring system. The thing is, the Global Kidney Foundation, we started to give awareness to the people that yes, those are, although on the machines, their lives are supported by the machines, but still they can do a lot. By myself, I'm giving my example. During that period, I flourished my business. I moved to other cities. So things we can do, patients can do. They just need a little bit support, and they need awareness. That what awareness they need to maintain their lifestyle, to maintain their things, and the families, they have to support them for their lifestyle. They should not consider them like life is going to end and there is no other solution. Yes, certainly dialysis is a part of that system to end up with the transplant, but within that period they need support. And we should agree to give them that support for with the awareness. Recently, we started some awareness programs, and many of participants, they know us. Grish is here, and Dr. Thurasingham is here. So we had a very good event in Ailing and Royal Palace, where we call all the celebrities, and we generated a fundraising about 4,000, and that we put into HIBA Foundation project of the Royal London Hospital, and which was the head of the department, they received that one. And the second one, very soon we are going on to, because I'm running also a Asian TV channel on Sky, very soon we are going, one of, I think, donor parents are here, Bobby, and along with Grish, we are going to create one awareness program, which is a weekly basis on the telly for the BAME community. So these type of things we are giving, but we need support from authorities, from the assembly, from the members, from local councillors to recognize this issue not as just a illness, sickness, or as a treatment, but as a part of their life system, that those patients, those people, those are on the dialysis, they could play a vital role. One example, in the assembly, they have already got the MP, Mr. Khalid Mahmood, He suffered a lot, and he actually now serving very well. So these type of things we need, and we need that support. And we should go together for the BAME communities, because BAME communities is the main issue within that the donors. And we are not giving much as a registrations in the NHS for as a organ donors. So hope with these sessions we can create a little bit more into the community. Thank you very much.
Okay, thank you very much for your contribution. Thank you. Yes.
Hello, my name is Salma Begum, and I'm the mother of 2 children who were born with kidney failure. Whilst my daughter Fatima, she received her kidney when she was 7 or 8, and it's still lasting, thankfully, for 15 years. My other daughter, she's had a kidney transplant for 4 years. She's 21 now, and it didn't last long because obviously with the BAME community and there's not enough donors from the BAME community and the matching and all that. I just wanted to mention about the impact on families. Yes, the individuals are affected, but collectively the family is affected a lot. When someone is ill, someone is vomiting in front of you daily, continuously. As a mother, as a father, how would you feel? Constantly seeing your child in bed. And dialysis does improve life, but people don't get to see the other side when they're at home. My daughter enrolls into a college. She wants to study, but after 2 weeks, she's in hospital for another 4 weeks. And she's on dialysis as well, and there are so many other associated illnesses. I'm very much for, mental health for these patients. Normally, with normal life, you do have a lot of mental health, issues. So, I always thinking that, how is it for the patients sitting there 6 hours a day, sometimes more, 3 times a week, and no scope for moving on with life or any movement. And it really, really affects me to see my daughter in that way, that she's basically kind of imprisoned. She's very ill in so many ways, and it just really affects me. And I'm working with Tower Hamlets, Kidney Research UK and Tower Hamlets Council as a peer educator coordinator, trying to promote kidney health and raising awareness of organ donation within the BAME community. And the other thing that affects me a lot is I'm a qualified lecturer. I can go to work, but I choose to stay at home and work because my daughter is very ill, and it really, really affects the whole family. My youngest daughter, who's 15, every time she sees me ill, she would say, she would cry, and she would say, why is it, I'm so afraid that I'm going to lose you as well. So it's just the mental health effect on the families and individuals are so much greater than, anyone knows here. So I just wanted to mention that.
Well, thank you for your contribution. And I know that my colleague will be picking up families and impact on families later on. So it's a very important area, and we're going to particularly focus on that in the next section. But I just want to, at this stage, look at people who are on the donor registers and what persuaded you to get on the donor register and what the problems were. Yes, sir.
Oh, yeah, I just want to take the opportunity to share our family story. My name is Bobby Mudhar, and I set up the Mandin Mudhar Memorial Foundation in memory of my brother who passed away, incidentally, 18 years ago this week, so the 7th of January 2001. In his passing, we took the decision, a decision that's really helped our family, to donate his heart and his 2 kidneys, and I'll come back to that. But I just want to give you a bit of a summary in terms of what our decision making was, what our motivation was as a South Asian, members of the South Asian community, and part of the Sikh community as well, which up until donating, I never knew anyone within my community who actually donated. I had a view of, I didn't even know what organ donation was and what the process was of doing that. So my brother was involved in a car accident. He was a rear seat passenger in a car that left the road on New Year's Day, 2001. We were told asked to go to Luton Dunstan Hospital, where he was initially, His injuries were so severe that he was transferred to the Royal Free Hospital in London. Whilst we were at the hospital in Luton, they told us that he will never be able to see out of one of his eyes. Now, the reason I'm telling you this part of the story is because it helped in our overall decision making. And my instant reaction to that was, is there any chance of, an eye transplant, an eye donor? Unfortunately, his injury was so severe that that wasn't possible. Anyway, so we were transferred to the Royal Free Hospital, where we stayed for 7 days, where they tried to save his life. Unfortunately, they couldn't. Towards the end of the week, we were approached by a transplant coordinator. So we're going through immense grief, and we don't know what we're living minute to minute. And I always say that transplant coordinator, that's one of the toughest jobs. And I remember the lady asking me, have you considered organ donation? And I said, well, and there was part of me saying, well, we're going through so much grief here, can you just leave us alone? But at the same time, I respected the fact that she came up to us, and it was something that our family had discussed. My sister and my brother, my sister Kieran had discussed it with my brother. My brother did say to her, should anything happen, he'd like his organs donated. And I'll come back to this point, because as a foundation, this is what we try and do, is create that discussion piece and that narrative within our community. I said, I'll get back to you. I took counsel from my family, like most, well, I don't want to generalize too much, but we had a GP in the family. I asked what actually does happen in this situation. Also at the same time, I spoke to some elders in the family, just to get the religious perspective. I've never known anyone in the Sikh community who'd done this, so for me it was quite important to know that, not that it would actually change our family decision, but just to see what it's our Sikh faith. And our Sikh faith, the pillars of the Sikh faith are selfless service, and I always knew that in the back of my mind, and so we were always going to make the human decision at that point. But what, they took counsel through whoever they needed to, and it's, everyone was positive for it. No one had ever been in a situation where they'd had to do this or knew anyone that had done it. So when my brother had the last stem test, and there was no coming back, he would never regain consciousness, I wanted to ask questions. What actually happens when you donate organs? Because that was, for me, that was not only a taboo in some cultures, but it's kind of is the unknown. So I wanted to know, because our decision was based on a number of things. One, we wanted to get some positivity out of this tragedy. The other thing was that when we went to Luton Dunstable Hospital, we asked for an eye donor. Now, if an organ could have saved my brother, we would have grabbed it. Regardless of who it came from, we would have wanted to save his life. So we're in a situation where I couldn't answer the question as to why wouldn't we donate in this situation. Why wouldn't you? It was the right thing to do. It was a human decision. So I asked the doctors and everyone on site what's involved. I even got a chance to speak to transplant surgeons who've only got a finite opportunity to take the organs out and take them away. So I asked them what was going to happen. We have a ceremonial wash the day before a funeral, before the cremation. And I was very conscious that the body would still be intact, so we could do that religious ceremony, and that it wouldn't be too harrowing for the people involved. I'll always remember this, and I always share this, because my dad and my mum and dad were there, and when the last results of the stem test were given, my dad literally said, take anything you need. The body is just a vessel. My son's passed away now. Take whatever you need. In the back of my mind, I was thinking about the ceremonial wash, and we asked the question, what organs would be most useful? My brother was 20 years old. And we were advised at the time that the heart and the 2 kidneys, they're in great working order. As a young guy, only started university that year, and that they would be useful. And so we said, yeah, it was the right thing to do. We couldn't really, answer the question as to why wouldn't we do it. And for us, selfless service, getting some kind of positivity out of the tragedy, and making that decision is the reason why I'm here today. It's a bit bittersweet, because I'd rather my brother be here, but at the same time, you deal with the cards that you dealt with, and you continue with what's given to you in life. And so if I'm here to talk about the positive impact that's had on me, my family, then so be it. It's you know, for me, I love talking about my brother, about our decision. And going on, it is really important because parents losing a child, you know, siblings losing their youngest sibling, how do you get over that? It's impossible, you know. It's kind of like almost like a story out of Casualty, you know, New Year's Day, accident, lose your younger brother. But the thing is, making that decision to donate has really helped us as a family. It's helped my parents. You know, you lose something when you lose somebody in your family, but it's helped them get through the next day, the day after that. And they can look back and think, wow, you know what, we actually did something in his passing to help other people. And that's got to be the right thing to do. I was informed last year that the individual that received the heart is still working, you know, 18 years on. The two people there was a young lady and a young mother, they got the kidney. That lasted for about 5 years for each of them. Unfortunately, one of them passed away, and that was complications due to ill health. The other lady was lucky to get another transplant, to get another kidney, so that's still working. To me, it's about giving an opportunity for somebody to prolong their life. That's like another year of experiences, another, you know, some more birthdays, weddings, some more experiences, and that's got to be the right thing to do. Thank you.
Thank you. Well, thank you very much for sharing that very powerful testimony. Thank you. That lady at the back, and then we'll have to move to the next section. Yeah? Oh, there.
I'll try and be very brief, and a lot of the information that the gentleman just shared, I also agree with. I lost my son Tom in 2015, in December 2015, but I just want to share something crucial in this. Tom died from a fatal blow to the head at hockey training, and in Whitechapel Hospital on that night when he was taken into intensive care, my husband, my late husband now, in the middle of the night said, do you think we should consider organ donation? And what's crucial here was when the organ donor nurse came to speak to us, she came and said, we found out that Tom signed up as a fresher at Nottingham Trent University, and he is on the electronic register. He signed up to be an organ donor. And the moment I found out that Tom had signed up to be an organ donor, then I knew we would not go back on our decision. We would support Tom. And of course, we went through with the process. But you asked, what makes you donate? When I found out Tom had already signed up, that made it very easy for myself and my daughter and the family. It's crucial.
Thank you. This gentleman, sorry, okay. Just
Hello.
the other assembly
members.
members.
Is it okay to calm down if it makes
That's
it better?
it's fine. You can speak from there, but
Okay.
just to tell the other my colleagues that people there in the audience also want to contribute. I wasn't aware of that, but thank you very much. Carry on.
Hello, everybody. My name is Hilaria Asumu. I've come all the way from Manchester today to speak to everybody about my experience. I just want to correct a misconception. The first lady who spoke said that dialysis is a cure. It's not. Neither is transplant. I think most people think that once you get a transplant, that you're all of a sudden you're better, but it's not the case. You still have side effects. I still tremble. Most people think it's because I'm nervous or anxious, but it's not. I tremble a lot. I find it very hard to type and stuff like that. Another thing is that even with my long-term condition, I'm also a donor, so I fit every, section you might want to think about. I had been sick for 10 years with kidney disease, which I got through a miscarriage at 22 weeks. And then I had multiple organ failure and took cardiac arrest. My lungs collapsed as well. And that meant, I lost both kidneys. I've done all three types of dialysis, neckline, peritoneal, and hemodialysis. Now, that didn't stop me because at that point in time, I was already running my own business. So I just got on with life. But I was told I had a 10-year plus wait. I was lucky. Last year in March, I got a transplant. And when I got the transplant, it was like a miracle because I'd lost my faith along the way. And I think my video is being used now to sensitize the Black community around the UK on the NHSBT website and also on Twitter and Instagram. Just last year, I'm trembling now. This is not nerves. I'm really close to tears because I had been campaigning for a long time in the Black community on my own. And last year, December, I lost a friend, my fellow campaigner, Pauline Obi, and she was buried on the 31st of December. When I put her obituary up on social media, it exploded. I did not know that she'd been reaching out to people, not just in the UK, Europe, Africa, America, everywhere. One thing we tend to forget and we don't acknowledge is that as a Black community, we are classed as one. But we have to remember that being Black doesn't make us one. We're all different. We have different cultures, we have different beliefs and different faiths, and different fears as well. So if you want to talk to the Black community, you have to divide them into the different places or areas they come from. Now in Africa, I'm African by the way, Nigerian by birth, we have a different culture, belief, faith and fears as well. And that stops us from donating. Now, with organ donation, it is not anything, it's not something we discuss. And when I signed up, I told my family I'd signed up to be an organ donor. It was like a bombshell because they couldn't believe that I would do that. But because I'd been talking to my sisters for a while, they knew that, you know, I wanted to do this. They understood, but my parents didn't. But I told them, I'm an adult, it's my choice. Somebody died and I got their kidney. And I want a situation that if I do go today, I want other people to actually get a chance. So I just didn't donate organs. I donated tissue. I donated my cornea because I want to be cremated. What am I going to do with it when I die? I'm not going to do anything with it. And my question most of the time, because I'm a campaigner in my community, I go to all the churches. I've been to most of the churches in Manchester, and I'm also working with NHSBT on any of the events they have going. I go out to speak about my experience because I feel that when people from my community, when they hear my experience and they see me and they know that this lady's been through this, they would sort of probably understand where we're coming from and try. And I have been a little bit successful because they find it very difficult. When I come out and I hold out my card and say, even with my long-term condition, I am a donor, I find that people are a little bit more receptive to sign up. And I've been lucky so far, even in the medical circles in my community, they won't donate. Because I was at a medical conference and I was talking to doctors and nurses, and it is amazing to hear the responses to my question, would you donate, would you sign up? And they say, no, I would give blood, but not my organs. That's because in most of our faith, they believe that, you know, when the second coming, that they have to rise up with their body, but it is not the case. It's a totally different meaning to what they think. So that is why I'm going around all the churches to speak to them and tell them that this is what's happening. It's not only that. Most people who have kidney disease and who are transplant patients as well, they have mental health issues, as somebody else mentioned. And because of the lack of resources, they suffer it alone. And it's not just that. In the African community, nobody will step out to say, I have mental health issues, because it's frowned on. You know, they look at you like, you know, you're mad, and everybody abandons you. So I have set up a community initiative which supports people like that. They have a safe space where they can meet other people like them and share their stories or share their issues, and everybody gives comfort to them. And I think that, in a way, for the committee to sort of help that area, to help people on dialysis who are kidney disease patients or transplant patients, you might want to look at a way to help people like that. Because when you become visible in the community, and it's not just sending anybody, you have to send somebody they can relate with. It's not about, because in our community there's a us and them kind of mentality. So if a white person comes into a crowd of black people, they would not listen to you. They want somebody they can identify with. And so I just wanted you to know that, you know, in looking for a solution, those are things that you might want to consider. Thank you.
Thank you. Can we get a mic here? And then I'm going to ask my colleague to come and take it over, because otherwise it'll be that I've spent too long on the section. But if you... Yeah.
Yes, my name is Orin Lews. I'm the co-founder of the ACLT, which is the African Caribbean Leukemia Trust, and I'm also the co-chair of the National BAME Transplant Alliance, the NBTA. But more importantly, I'm the father of a boy who's very much a catalyst for change on serious health issues like donating something of yourself. His name is Daniel DeGale. Now, Daniel suffered from all forms of donation. Initially started with us needing a bone marrow stem cell donation, which took 6 years before a donor was found, because of the same problem in the black community on stem cell donation as you find in organ donation. He also needed blood transfusions right from the age of 6, right through his journey. Issues on race matching, on well-matched blood comes into that as well. But at the end, he needed an organ transplant. And that's the reason why I started and then my family started, because of self-need. Daniel passed away 10 years ago of multiple organ failure. He was just about to be blue lighted to the Royal Free Hospital, but he didn't make it. Now, Daniel's shown, and one person and the community can show, when you get a catalyst who makes people sit up and feel the message from the heart. And Daniel and myself and his mom and our charity and broader challenges that are going on have made a difference on the big spike relatively on stem cell bone marrow donation. Blood donation is picking up. There's still more work to do. But on organ donation for the last 10 years, we've been doing a lot of work individually, collectively, through the NBTA to try and get black people to step forward. And even when I was coming into the building just now, someone recognized me and congratulated me on the work we're doing. Congratulations are fine, and we're speaking to the converted already in this room. There's those who are watching and listening, and those who are seeing social media messages and the likes have to feel this going forward, because we want people to be signing up in Daniel's name or anyone's name, in Bobby's name or whoever's name, to step forward. And the black community, the Asian community, those two communities alone are suffering. And to me, we're at a real endemic point right now, because we're shedding blood on the streets. Every day it seems that a 14-year-old black boy gets killed. And that crisis is going on. But at the same time, the lack of inertia within our communities on this end, on saving each other's life, when they don't seem to realize or don't seem to appreciate how on certain organs, the tissue matching, it comes down to ethnicity. We have to take this message back to our communities through this and onwards, because the clock is ticking. We've got just over a year before legislation will kick in. And just like the crisis on the blood donation side, where sickle cell patients desperately need blood, on the stem cell bone marrow side, where we need more black and Asian donors, even more so on the organ donation side, if we don't do something now, everyone else outside our communities is going to be looking and saying, well, we would love to help you, but we cannot. So it is up to us. And so today we really need to come out of this from a self-need, which is why I started, but take it beyond that so that we get more people having these donor cards and making it much more the case of we're the majority and the minority of those are like feeling I need to actually be on the case because we are discriminating against our own. So it's up to us. I just wanted to say that.
No, thank you very much for that very powerful message. Of course, this is about how we get this message across to people and how we start looking at what the barriers are, right, for people to stop. But let me just close the section at this level here. And Sue, if you will take over the next section.
Thank you. The gentleman that's just spoke just articulated the ignorance there is for all of us around these things. I'm going to talk to you or ask for your views, please, around the role of families. And one thing that, whilst I was reading for this particular occasion, I had no idea that if a person decided to be an organ donor, your family could overturn that. I never knew that. We've done a survey, as we've referred to before. 74% of the respondents were as ignorant as I regret that I was and didn't know that. 80% of the survey respondents had never talked about organ donation with their family. And only over half of them hadn't told their family of their decision about organ donation. So my question to you really is, what impact has making the decision to share yours or loved one's organs had on your family? Would anybody like to comment on that? Gentleman over there, thank you.
Thank you. My name is Kirit Modi. I'm a kidney transplant recipient, and I've been involved in this work for many years, and with Orin, we co-founded NBTA several years ago and so on. My personal story as a patient is slightly different from the ones you've heard. I've been very lucky as a patient, because 25 years ago, when kidney problems were diagnosed, and the way they were diagnosed was my blood pressure was very high and could not be controlled with normal medication. So that's how it was picked up. And to find out that you got problems with your kidneys, it was devastating. You can imagine I was in the peak of my career and so on, small family, and so really it devastates you. So the first question is about you go and find information, and I'll mention where there are places, some places where you can find helpful information when you get to that stage. But focusing on the family, the thing we started doing was saying, okay, we know I didn't need a transplant immediately. So obviously you go on a special diet, reduce your potassium intake and so on to protect the kidney as much as you can. We managed to do that for several years. But then to say, look, we've got two broad options. We've got either dialysis or transplantation. And you explore both. And this is where the family came in. And we were lucky because within the of Hindu background, within the Indian community, we have an extended family. So you talk to your extended family about this as best as you can. It's not easy. Now we have a lot more resources available, so you can send people links to videos and so on, which we didn't have at that time and so on. And that's what we did. And a number of members of my family volunteered to be a live donor. And they were tested. Some are not suitable for a number of reasons. But my wife was suitable, and I had a living kidney transplant over 18 years ago. And my message, in a sense, is slightly different, because I know we've tended to focus on the organ donor register and donation after death. But I know Chair, you kindly mentioned living donation in your introduction. Because the fact is that if you look at NHS blood and transplants statistics, from the BAME communities nationally, there are more people who donate a living kidney than the number of people who donate organs after death. Now that surprised me when I first found out, and I think still a lot of people don't know about that. So the message I give to people who are at this sort of stage where they're waiting for a kidney, I'm talking particularly about a kidney because that's probably the only organ you can give while you're alive and so on. Although you can give part of your liver, although that's very rare and so on. I give a message I give to people from BAME background that if you know anyone in your family or your extended family or a close friend who needs a kidney and is well enough to have a kidney transplant, because not everyone is well enough to receive a kidney transplant, then you must do everything you can to try and be a living donor. because your chances of getting that are higher. Statistics tell you that. We also know from all the analysis which has been done that a living kidney transplant is better for the recipient than a transplant from a deceased person. So the point I'm really making is that as we develop these discussions and whatever further action the Assembly decides to take on this, let's make sure that we talk about living donation as well as donation after death. And finally, I'm just going to say something about where you can get information. The first thing is that we have many local kidney patients associations. These are voluntary groups set up and down the country. So in London, for example, at the Royal Free, at Guy's and St. Thomas's, at Hammersmith, we have excellent local kidney patients associations. These are run by patients like myself and carers and so on. Turn to those and they will give you support, and you can talk to people, in fact, who have perhaps gone through these sort of experiences. The second is a national body. I'm involved in the National Kidney Federation, which is the largest kidney patients charity run by patients. And we have a helpline, a free helpline, where you can ring that number and there'll be somebody experienced who can talk about any issue you want to about kidney matters and so on. So my story is slightly different, but the key message is, one is about living donation and other is about there is help available. Thank you.
Lovely, thank you very much. There's a lady down here that would like to contribute.
Hi, my name is Sheena Vizram. I'm here as an organ donation ambassador with NHS Blood and Transplant. I think my story follows on quite nicely from the last one, as I'm a living kidney donor. Now, kind of my background is kind of in healthcare for 15 years, so I've been surrounded by some of the amazing things that we can offer within healthcare, and that's astonished me. But in 2013, what I had was a slightly different opportunity. Now, my father, he grew up and had a rare disease. It was something that I knew about for all of my childhood. We all did as a family. Bit by bit, his kidney function started to deteriorate. And come 2012, 2013, we started to have more critical conversations about what we could do as a family, what we could do as a community, what offer there may be out there, and what choices he might like to consider. Now, in August 2013, I had the lovely privilege of being able to donate a kidney to him. It's interesting, though, because I am a daughter who donated to a parent. Apparently, that's quite uncommon. I'm also from an ethnic minority. Apparently, that's less common, too. It was a live donation. That's less common than perhaps a deceased. But also, it was preemptive, which means that my father never had to go through dialysis. Now, with all of those things, if I was to offer any sort of advice or an ask, it would be that that only happened because of the support from the healthcare community that I could reach out to. It only happened because I could have conversations early on. They weren't necessarily in a hospital environment. They took place at home. They took place with friends and with family over a period of time. It was in our own setting, in our own time. And that meant a lot. I would like to ask that we try and find a way to ensure that those people who were curious enough to think about live organ donation, who wanted more information, clarification, had that same opportunity, not to perhaps have something to talk about at the very last moment. Through periods of intense stress, the emotional toll is huge, but slightly earlier on, with friends and family present, with as much notice as possible, but with access to some of those people who could hold the best kind of information and evidence base to help guide what the opportunities that there are out there.
Thank you very much. There's a lady at the back, and then perhaps if we can think about how we can have conversations when there's nobody that we know needs a transplant, when we're thinking of carrying a donor's card. It's the conversations that we have when it's not imperative that we have those conversations. So if we do that lady first and then somebody up there. So
hi everybody, my name is Polly and this is my brother Richard and I am a live kidney donor. I just really want to, following on from yourself and the gentleman, very similar story, but I want to read it if you don't mind.
I should say I am the recipient my sister's kidney.
So my story starts, as a child, my brother Richard had a kidney problem, and this was something he grew up with, but let's fast forward to 2007, when my brother was told that his kidney was deteriorating, and he should look within the family to see whether we could donate. We had discussions with Richard, and I said I would donate to him if necessary at that time. However, in 2009, it became necessary, and without hesitation and behind the scenes, I discovered that I wanted to make sure I was able to donate to him. So behind the scenes, I had all the tests, and then in 2010, I donated to Richard, once I got the all clear. Initially, Richard didn't want me to do this, but it was my choice, and I decided that's what I wanted to do for him. On January the 21st, 2011, I donated my right kidney to Richard, and this was called a hand-assisted nephrectomy. The operation went really well, and recovery for me as a live kidney donor was about 8 weeks before I was able to return to work. I would say to anyone thinking of donation to really think about it, because it is a risk to the donor, then more of a lesser risk to the receiver. And to consider the risks and to speak to family and ensure that you've got family support and friends who can support you. My health now is really good. I drink lots of water. I stay away from alcohol sometimes. And it's been 8 years now, and as you can see, Richard's doing really well. So I'm an advocate of live kidney donation. Thank you.
Thank you
Can
very
I just
much.
add to that? For me as a recipient, I've always appreciated what my sister did, but at that time I felt that I didn't, because when you're told that your kidney is deteriorating and you need to, there needs to be some sort of interaction from the medical profession, you almost, you sink into a state of almost darkness, because you don't know what you're going to do, and you don't really want, I didn't want to put that type of pressure on my family. I was told to take home videos and pass it on to your family and extended family, but I took them home and just put them down, because I felt everyone's got their own lives to lead. We're all adults, we've all got families, and it wasn't something that I felt that it was my problem, and I felt that somehow that, I had to deal with it. But my sister went, and without my knowledge, I think my wife phoned round, and she phoned my family, and without my knowledge, this was going on behind me, really. Yeah, I didn't know any for about a year, and then all of a sudden my sister said she was a donor and she'd gone through all the tests. And my mum called me, and she said, my late mother, and she said, Richard, you really ought to take that kidney, you know. Your sister's offering you. It's a blessed thing she's doing for you, and we'd all want you to have it. So at that point I decided to take it, and the rest, although it wasn't plain sailing, the rest was history, really, because it was quite a surreal experience, because to go back through the whole process, because we had to demonstrate to the NHS that my sister was doing it on her own free will, and we had to go through and it was quite surreal, because we had to prove that we were brother and sister and go through the whole process. But 8 years on, I can testify that my life has changed. Although I was only on dialysis a few months, my life has changed from that, and 90% of what I used to do as a younger person, a younger man. And so that's it, that's our testimony.
Well, thank you for sharing it with us. Thank you very much indeed. Is there somebody, that lady?
I'm Prafula Shah. I'm a live kidney donor. I donated my kidney to my niece Shakti through the National Kidney Sharing Scheme, because I wasn't a direct match to her. And I mentioned the scheme because it's a really important scheme that not a lot is known about, And I certainly didn't know about it. And in terms of looking at the whole family and how this affects the family, Shakti, my niece, was born with one kidney, and that wasn't also functioning at capacity. So we had known from her as a child that eventually she will need a transplant, and we had a long time to prepare for that. In our family and our extended family, a lot of people tested when Shakti's time to be transplanted came, which was last September. Shakti herself, and I concur with the gentleman over there, Shakti was very nervous about asking anyone to be tested, and I've heard from a lot of people who are waiting for transplant saying the same thing. They don't want to ask people. And Shakti was exactly the same, but her mother, my sister, and my other 3 sisters, we became advocates for her for looking and publicizing the fact that she needed this transplant. Lucky for Shakti, we went into the kidney sharing scheme because none of us were a direct match. And in the first run of that scheme, a match was found for Shakti, and somebody needed my kidney as well. And it was a match that they needed. So I donated my kidney last March. I've become an organ donation ambassador to the NHSBT, and I'm also doing some great work with the MBTA, which Kiripa just mentioned earlier. My experience has been that families are actually very secretive about these things. I don't know why, but actually the awareness raising starts there. It starts with the families, and families really need to talk about this at the earliest possible stage so that it almost becomes a normal thing to talk about and not a taboo. In the work that we've been doing promoting organ donation, I've been talking about live donation as well as donation in death, and it's interesting. Until they hear from somebody who speaks up, people's view is that actually it doesn't affect me and it's not something I need to do. Actually affects all of us, and I concur with Orin. He said self-help. And I think the community ourselves really need to take this on board, that it is actually about us and our communities, and we really do need to do this for our own people and our own communities. There's a lot of fantastic work going on to actually take this message to the BME communities and faith communities. But I think if we can somehow make this start at the lowest possible, at the earliest possible stages. So I'd like this message, if there was a message from this, is to start much earlier, and let's take it to schools, let's take it to colleges, and actually let's not be afraid to handle those taboos that people talk about and those cultural differences. And people do have a lot of cultural differences, and a lot of faith communities have very different views. But actually we should know about those, and so we shouldn't be afraid to have that conversation. So I'm, of course, an advocate for live donation because that's what I've done, but actually donation of any kind and self-help are 2 things that I would really like to promote and say, actually, let's start talking to our people and our communities, and that starts with our families. Thank you.
Thank you. And very well said. We do need to be talking about this when it actually doesn't affect anybody, to see if they will carry a card. Did that young lady just want to say something? I think my time is then nearly up. Has somebody got a...
I do think having that conversation is really important, but from what I can see from your research, it's that attitude versus action gaps. You're willing to be a donor, but you haven't necessarily signed up. So we need to be able to provide an incentive to our communities in some way for a potential donor to sign up on that register. But what that incentive is, it could be that relationship between a donor and a recipient. So that's the gift of life, but you could have other incentives out there. I'm struggling for ideas, but there's wider research around that. So, I don't know, funeral benefits for those that are deceased organ donors, or say, it's a bit like the sugar tax that is out there that's reducing obesity. But obesity, an unhealthy diet is also linked with organ failure. So it's just adding on to those campaigns that are already out there, I think, to promote that discussion.
Thank you. We'll take note of those comments. They're very useful. Is it that gentleman there then, and then we'll come?
I'm Jay, and this is my wife, Sina. I know some of you guys in the room, and I think most of you have heard our story, but I think I take comfort from the other families that are here. So I'm a donor family. Sina and I, unfortunately, 2 years ago on the 23rd of November 2016, we lost our son. He was 3.5 years old. Ari had a fantastic 3.5 years with us, and we are blessed to have those 3.5 years with him. Unfortunately, he passed away in an accident, and I remember 4 days of intensive care where Sina and I didn't speak a word about organ donation. All I remembered was when I met Sina 23 years prior, when we were dating, that she got her driving license, and she told me that she wanted to be an organ donor. And we spoke about it literally for about 10 seconds. That was it. And then when we were told at 2 in the morning when that Ari's brain, the swelling on his brain was too much and that he wouldn't survive another 72 hours, I instantly, and those of you who have watched our video on the NHSBT website will know that we actually told the consultants to donate every single organ they could and to save other children, because if we were in the same situation, we'd like to receive an organ. Thankfully, there's one thing that I want to, a couple of things I want to say about that. The consultant that we met at 9 o'clock that same day, we met 5 consultants and 4 nurses within 5 hours of that decision being made. And one of the consultants that was going to operate on Ari said, "You have just given us a diamond." It is very rare for a child of such a young age to be a donor. It doesn't mean that it doesn't happen. It does happen. Our decision wasn't faith-based. It was just based on human nature. We made the right decision for our son, and I think if Ari was here today, he'd say, "Dad, you done the right thing." One of the things that's important for Sina and I is that we work alongside Katie Portal, and we are NHS ambassadors as well, like many of the others in this room. One of the things that we do is we talk to all communities. I'm a Hindu by background, but I've never been religious to an extreme extent. But I respect the different faiths that we have in this wonderful city and in this wonderful country. But I remember having a conversation with my mum at 9 o'clock that morning, because I didn't know her thoughts or what she'd say to me. And her view was, "You've made me proud, you've made Ari proud, and you've made the best decision of your life." I think 7 organs were donated, and those children that received Ari's organs are alive. There are respectively 2 children, 1 of 2 and 1 of 3. Those children at the age of 5 and 4 are alive today, and I'm very, that's how proud, there are other donor families here. I don't take anything away from you, all 3 of you that have spoken. We are truly proud to be able to give that back and keep that memory alive of those individuals. But one last thing, his twin sisters are now 3.5, or coming on to 4. At the age of 2, straight after Ari passed away, we signed up his sisters to the organ donor register. One of the myths that people may or may not know is that there is no age limit on being an organ donor. There is obviously consent that's required for any minor under the age of 16, but you can actually sign up at any age. And I think one of the things that I know his sisters will do is they will educate others in all communities and talk, because they talk today, every day about their brother. They just think of him as being in the sky. They don't fully understand where he is. But there'll be a day that they'll understand that he gave the ultimate gift of life. And I think reaching out to those communities, as you did say earlier, at a younger age and across function communities is actually important. And I think the last thing is that Ari's story touches a lot of people because of his age. And I think we will never stop talking about Ari, and we will continue to campaign on the positives of organ donation for all of us. We don't know what religious background or what ethnicity the recipients are of Ari, but I'm sure that they're doing well wherever they are.
Thank you. Thank you. Have we got time for anything? Have we got time for another one? Okay. The last contribution on this section. Thank you.
Thank you very much. And I think we are incredibly honoured to have the donor families and Ari's mum and dad here to talk about the difference that their son has made and will continue to make, as with all the other donor families here at the moment. My name is Fiona Loud. I'm with Kidney Care UK, with a national kidney patient support charity. But the reason that I'm alive is because of a kidney donation. So 1/3 of the donors in this country are living donors. For myself, what I would reflect on from my own personal learnings is that I spent 5 years on kidney dialysis. And at the time I was told, oh, it's probably better if you wait, because I was young then, wait for a deceased donation. But actually, I would say to everybody now, don't wait. If you have a living donor, which I did, my husband, who was always willing to donate, it is better for you as an individual to take your donation sooner if you are fortunate enough to have that opportunity. So we talked a lot about families and sharing that with families, because it really does completely transform your life after what is, and you've heard from many others, a very, very difficult thing. So what I'd like to do is just reflect on some of the other things that have been mentioned today. One was that perhaps the perceived difficulties in getting psychological support for patients who are struggling with the fact that they have, in our case, kidneys are failing. And a piece of work that we did at Kidney Care UK, which was to look at the availability of that kind of support. And we found that just 5% of the kidney units in the country are able to offer that kind of support, that sort of counselling that people might need. Because some of that can help people in how you ask, how you talk to your families. And one of the learnings that I've seen over a long time is that people find it very hard to ask. They will come onto our social media and they will ask each other, how do you do this? And people will give each other advice, but they find it quite hard to let people know, to explain why it might be important for them or for their families to be able to receive a donation. So, but something that we can do is we do have a counselling service. It's a telephone counselling service that may be able to help some of the people who need that support. Secondly, I'd just like to touch on the change of law that you, well, not the change of law, but the finding that you said earlier that you hadn't realised that people could override a decision to become an organ donor. Families could potentially override that. And I wanted to mention the fact, I don't know whether people are aware, but there is at the moment a bill going through Parliament to look at changing the law towards deeming consent so that you are an organ donor unless you have chosen to opt out in life. So we have probably a unique opportunity at the moment for a national conversation around organ donation and what that means. We've talked quite a lot about living donation here, but also, but this is particularly, of course, about deceased donation. The importance will always be there for families to be involved, but people, perhaps some people will find it easier to be able to say that I'm happy to become a donor, but I don't necessarily want to go off and sign up somewhere to do that. But however that bill works out, this is the first time we've ever got there in England. It's also happening in Scotland, and people may know it happened in Wales 3 years ago, and after 3 years the situation is now changing in Wales. So I think it's something like 75% of people are now, families who are now agreeing to donate the organs of their loved ones, which is actually starting to show, you know, a statistically important change in the way the donations happen. So I wonder whether what the London Assembly intends to do and how perhaps you can work with that, because it is absolutely cross-party. It's about humanity. It's about the stories that we've heard here today, and about people like us whose lives can be changed through that. And finally, I just I mean, I'd just like to mention, I've talked about Kidney Care UK and our work in terms of advocacy, in terms of support, in terms of counselling, and in terms of the advocacy offices we have. But I'd also like to mention the work of NHS Blood and Transplant, who do have a lot of information here online to be able to share, and resources to help with education for children, families and so forth. And we refer to that quite a lot in our work now. So that's something that's been put together with the community, with many of the people sitting in this room as well. So I think that'll be important as we go along to get consistent facts, because I think this whole thing about fake news, it's really important that we are clear, consistent and open and transparent about how we talk about organ donation, and the fact it's there to help everybody, and we do have a fantastic opportunity to do more, because 3 people every day will die waiting for a transplant, and we know that many of those are from the multiple communities that we all seek to serve.
Okay, thank you very much indeed. Thank you, Chair.
Thank you for that, Susan. We're going to have a 10-minute break now, because we have very kindly, we have a sign language interpreter. She needs a break, even if we don't. So we can have a 10-minute break, also a comfort break for all of us. We've covered the individual, the families. Next section we'll look at the community and the big picture. And then we'll move to the third phase. But let's have a 10-minute break, and then we'll all regather again. Thanks.
No, that's fine. No, so so Umesh, yeah. No. Oh, okay. No, that's fine. I was thinking, oh my God, have they indicated to you guys? No.
seats again.
Just picking everything. Thank you.
Great. Look, thank you very much. The event is going very well. I can see a lot of excitement and a lot of enthusiasm, and we want to capture all that. But of course, we are slipping on timetable, so let's try to get some time back. But if I could just ask the contributors to be very focused, okay, and make sure that we don't make big contributions. I mean, this is difficult coming from a politician who politicians are always waiting for microphones and now want to give them up. But first of all, let me just welcome Assemblymember Flu Ashimoli, who's standing in for Assemblymember Umesh Desai, who unfortunately couldn't come here because he's been held up in some other urgent business. But Flo also has some life experiences which you may want to share, but I'll be very grateful if you lead on the section on communities. So hopefully keep contributions very focused, please. Thanks. Over to you, Flo.
Thank you, Onkar. I'm Florence Eshilomi. I'm the Assembly member for this area, Lambeth and Southwark, and the two boroughs I represent, you know, deep in the heart of South London, very diverse boroughs. So this is a very live discussion now. And for me personally, this is also very topical and an issue that's close to my heart. My mum suffered from sickle cell anemia. And for those of you who know about sickle cell, one of the side effects of sickle cell is organ failure. And my mum was on hemodialysis for 12 years. And there was a time when I'm the eldest of 3 girls, I offered to be a live donor. And my mum's first response was, "You haven't had kids yet, you can't do it." And I think, you know, that's some of the misconceptions that comes from families and our BME community in terms of, you know, not wanting to put yourself forward. Behind her back, I went through all the tests with King's College, but unfortunately I wasn't a match. And I think it's about how we encourage more people from our community, and especially the power that women within our community have in discussing this with our male counterparts and our male family members to actually think about coming forward. In this section on our communities, we're going to be looking at the fact that there is still a lot of work to be done in terms of actually educating our communities and dispelling some of those myths. The fact that a number of people feel that they can't donate because of their faith, a number of people feel that they can't donate because, you know, not wanting to upset a family member or because they're from a specific ethnic background. So we need to look at how we dispel some of those myths and the fears that people have around organ donation. We also need to think about how and where people are getting information from. In this era of, you know, to use a terminology that's bounded around fake news, making sure that people are getting the right information about how you can be an organ donor. And we also need to look at how we can find that space to make sure that, you know, our communities are talking about organ donation. So it'll be really great to hear your thoughts on these 3 areas in terms of how we collectively as a community, the BME community, work together to discuss this really important issue. And there's a gentleman in the front here. Microphone.
It's coming round.
He's just in the front here.
Hi, I'm Kirit Mistry, Chair of the South Asian Health Action Charity and also Co-Chair of National BME Transplant Alliance. Firstly, a sweeping statement, but I think it needs to be made. We can't rely on institutions to do this education, to engage our communities. We set up the charity on the basis that we have to engage patients and communities. Their voices are not being engaged in the channels that have to be, in the structures that exist. So that's why we set up our charity. We educate our communities, and as patients, we've got to come forward. And finally, we've got to empower our patients and communities to ensure. We've had to look at your question about who are the right messengers. We've heard some very good statements today from testimonies from recipient and donor families, but we've got to look at in our own local area. We had a young lad, well known within the Sikh community, you know, Tony Singh Pavla. He died. He set up Punjab 2000, but his family didn't know that he was an organ donor, but he was campaigning for organ donation. And on his anniversary, we set up Sikhs Embrace Organ Donation. We've set up a number of other campaigns, but the challenge we're having with our communities is that getting the communities to come on board and take these campaigns into their communities. And it's the right message. It's talking from their own holy books. It's talking from people that they know, who's respected. But the challenge we now have to do and go back out is get who are the right messengers. The right messengers are definitely recipients, donor families, religious leaders. But most importantly, for the last couple of years, NHSBT have developed a BME toolkit for MPs, launched firstly in 2017, and then relaunched again this year. We need to get some of our MPs in our local areas, because they, again, people turn to them as key messengers. But finally, I think what we need to say is we've got people here already who can't get support from the NHS, who have developed the campaigns on their own back. You know, we've got a family over in the audience, Anita Sandhu and her daughter Natasha, who've taken the campaign off their own back, got respected artists, got respected communities to engage. And I think my last point really is that we've got to change behaviour and attitudes. And, you know, as I said, my starting comment was we've got to do what Mahatma Gandhi said. We have to be the change. We have to go out there, change behaviours and attitudes. Because at the moment, a lot of us, our charities and others, are doing this from our own pockets, are doing this because we're passionate, because we have the voices not being in the right places. And finally, one of the families I support in Leicester, again, they lost their daughter at the age of 12. They wanted to get their story out, but the systems weren't able to. It was only when I engaged with them and said, right, you've been in contact with this family, the recipient received a kidney from the family's daughter. It's only now that that recipient has bonded with the family have been able to deal with the loss of their child, because now the recipient's given birth to 2 children. And now this bond is, but they're the messages, and it's about we've got to, as a community member, we've got to support these case studies, these families, to get their story out, and that's the only way we're going to change people's behaviour and attitudes as well. Thank you.
Great, thank you very much. This lady in the front here wants to contribute. I'll come to you next. That's fine.
Sit down or stand up. She's talking. My name's Naomi Adam, and I'm a kidney patient. I have end-stage renal failure, and I was just recently diagnosed back in October. And what I found when I visited hospital, and they initially talked about living donation, and I was encouraged to go away and talk to my family. But as someone who's recently diagnosed, no information was actually given to me to go and have the discussion with my family and to talk to them about it. And then secondly, I had to go and dig and search for information about that affects me as a black woman and in my community. And I have to say, finding this information was really hard. Came across 2 websites about organ donation. The resources were very poor and out of date. So if you are looking for information on organ donation and how to have the discussion, you can't find it. So much more needs to be done. And especially with a lot of the myths and misconceptions that go around in the community, those things need to be addressed so that people can have satisfying answers to the questions that they may have or the concerns that they may have. And for example, some black people recently came across, posted a video, organ donation onto black communities on Facebook. The response came back, you cannot post that here. Black people do not donate. And then there was videos that came up saying there's a lot of distrust amongst health professionals when people donate their organs. If they donate their organs, it's going to go to a black person. Where is it going to go? So people don't know what is happening. But also the information with health professionals, they need to come together. I recently went to a seminar at my local hospital where I'm a patient. It was fantastic, where living donors and people who had received a cadaver donor, the surgeons were there, the nurses were there, receptionist donors were there. all your family could invite whoever you wanted to come, but it only happens 4 times a year. That is not enough. It needs to be happening a lot more regularly, because the only way you're going to have satisfying answers is if it comes from the right people.
Yeah.
And not for all these myths amongst the community to be circulating, because that will prevent more people from donating. So more facts, you know, real information needs to come together.
No, thank you. Just on that last point, I think for those of you who are on numerous WhatsApp groups where from time to time I mute them, I'm sure I've received one about organ donation and some of the myths around it. So it is so important that we do dispel some of those really, really untruthful myths, where essentially that's stopping people coming forward to register, and that in turn is stopping someone in terms of saving a life. I'm going to go to the lady there, then I'll come to Orin in the front there.
Hi, good afternoon. My name is Della Ido, and I'm the founder of an organisation called Gift of Living Donation. And we raise awareness of living donation in the black community. And I also came forward as a living donor for my brother. I think it's very important that we, as the black and Asian community, that we actually do take lead in terms of trying to increase organ donation within our community. Currently, our organisation is working with Guy's Hospital, and we've set up what we call a black peer educational scheme, whereby actually you've got black volunteers who have a bit of knowledge about living donation, and they actually talk to other black families who are considering organ donation within the black community. We've got some of them here in the room. Gillian's one, Polly's one. And what that actually does is that they actually talk about their experience from a black perspective, and all the resources that they have in terms of materials, they're all culturally related and relevant. And what this actually does is that it actually helps to build a lot more trust, because we found that a lot of family members listen more, they hear more, they ask a lot more questions that are relatable to their culture. But what it does, it actually gives them a lot more confidence and a lot more trust. So when they have this information, they can then make better decisions about organ donation and transplantation. But we as an organisation, we as a black organisation, actually had to present this cultural engagement to the hospital. It wasn't there. So what we've actually done, we've actually gone as an organisation, said, look, you've got a gap. There's a need here. You're not supporting the black patients enough. So we actually had to go as an organisation to actually go to the hospital. So what we've done, we've actually worked with Guy's Hospital to put these structures in place. So if we hadn't put those structures in place, then it wouldn't have happened. So it's very important that actually the structures that are in place are able to support black parents and black families. But what I will say in ending that, I think that we as black and Asian organisations and charities, we actually have to work very closely with healthcare providers. Yeah. We have to look at the systems, we have to look at the structures, the policies and the services that are in place, and also make recommendations that will actually benefit black and Asian peoples. I think when that takes place, then I think then you'll actually see more black and Asian people actually considering organ donation.
Great, thank you very much. Orin, and then I'll come to the lady there. So just in front here, please.
Just want to emphasize one or two things that have been said earlier in terms of the starting point of this conversation that we need to have in our communities is understanding what are the barriers, the myths and fears and taboos that can be overcome, and who the messenger is. When me and my wife Beverly, the girl, started our journey for our son on the stem cell bone marrow side, we had the same problem then. Black people would not register as bone marrow stem cell donors because of the many prevalent myths and fears and taboos out there. We got through that, which is why now when you mention bone marrow stem cell donation within the black community, it's not a case of who, what, no, I'm not even going to consider it. Now there's a conversation going on, and people are registering, and lives are being saved. I got a phone call just today to say that someone that joined at a football tournament recently in June last year is now being considered to be a donor, and things like that. People coming to hair shows because they got the message in the way, in their comfort zone, in their domain. That's what you do. You take the message put it to the right messenger and give it to the people in their whether it's their home or a social function or whether it's a social media or whatever platform. And what resonates a lot are case studies, successful case studies, like my son's Daniel the Gale and other case studies that actually get people to say, you know what, I can do something. And you get a huge domino effect because now lives are being saved on the stem cell side. The same thing is happening, but to a lesser degree on organ donation. But next to me, this young man, Lonyo, is the embodiment of what can be done when someone is actually going through this and actually finds a donor and is actually there going out and speaking. And I think, Lonyo, if you say one, two things just to highlight the point I'm making.
Hi, my name's Lonyo Ngeli. I have had a career in music and TV. I'm very fortunate. In 1992, while I was at Queen's Park Rangers, I was diagnosed with diabetes. So I was sent home from England camp, and 2 days later, I was diagnosed with diabetes and I was on insulin. So I was on insulin for around 24, 25 years, and then the complications started. Loss of nerve tissue, eyesight, partially going blind in one eye, high blood pressure and the like. And then it transferred in 2015 to my organs. So I was told by one of the doctors that my organs were failing and it was working at 27%. And if I didn't have emergency surgery to start dialysis, then I would probably die within 2 months. So my family background is my dad was a neurologist for 30 years in the NHS. And I was never a donor. We'd never spoke about it. It was never something that came up. And up until 2015, a lot of these stories I'm hearing, a lot of myths around what the NHS wouldn't look after you properly if you donated. Where would your organs go? Would they look after you? The list goes on. But when I went forward into my dialysis, as soon as I walked in the ward on my first day, I noticed that 80% of the people in dialysis were black. Yeah. Old, 50 and over, so apologies to anyone who's over 50. Middle-aged, there you go. There is an echo in here. And it shocked me. And it was then my eyes were opened to the lack of organ donation within the black and Asian minority groups. I was on dialysis for 6 months, and my surgeon, one of my doctors said to me, if you go on the kidney donor list, you might wait between 3 and 5 years for an organ. However, if you go on the dual donation list, which is a new pancreas because you're diabetic and a new kidney, then the wait will be significantly less. Having been grounded from filming and music and stuff like that, having to stay close to my hospital, having to be on 200 mils fluid limit a day, which included meals, my thought process was just get it over with as soon as possible. So I said, yeah, just put me on the double organ transplant list. Within 3 months, I received the call, and I was fortunate enough to get a double organ transplant. So in November 2015, November the 4th, I had a 13-hour operation and 4 months in hospital, but I'm no longer a diabetic and I no longer have to do dialysis, which I'm very fortunate for. I think what disappoints me a little is that after I realized how lucky I was and I tried to go back into the hospitals and offer my services as someone who is quite well known in the music industry, one of the few British actors to win an award in America, that I would offer my services for free to speak to young people, similar age group to myself, who would understand the language I would use. And it was a bit like applying for an astronaut's license. It just brick wall after brick wall. So it is a bit, it does knock your confidence a bit. I still do a lot. I'm a radio presenter, so I do a lot. I try and do what I can. However, I think the platform, especially with people who've received organ donations, I wasn't a parent before. I've since had a baby girl who's 18 months. I have another baby girl on the way. And so a lot of people have talked the talk. I can talk the talk and walk the walk because I've been there. And I just think, like this lady said here, there needs to be a platform where there are hundreds of myths going around, but there isn't one direct place to dispel those myths, for someone to throw a link up and say, actually, no, this isn't true. That doesn't happen. This happens. But yeah, I'm just very grateful, and I think this is amazing that we're all here today sharing our stories.
And thank you very much for sharing your story. And maybe that's a recommendation that the Health Committee could be looking at in terms of our discussions with the NHS organ donation website in terms of the information that's up there. There are a few more people, again, mindful of time, and if we can keep contributions short. The lady in the third row here, yeah. And then gentleman in the front here. Yeah, lady back.
I am Usha Shah, and I'm a peer educator trained by Kidney Research UK. I have no personal experience with kidney disease, nor has any member of my family, but I have been campaigning amongst the BAME community for the last 10 years, out of which 2 years was a part of a project and it was paid for. But since the last 8 years, I've been just going into the community and trying my best to campaign for the BAME community to come and join the organ donors register. At times, it has been like hitting the brick wall, and at times it has been very, very positive. There have been instances where we have signed up 150 people in one 4 hours community gathering, you know, lunch and music events and things like that. But the thing is, we need people like me, from like peer educators, ordinary people, to go into the community and try and talk to them. We don't necessarily get up and give a talk. Just have a table with all the NSSBT and kidney research materials on there, some pop-up posters, and just be there for people to come and talk. They ask questions, they want to know what it is about, they want to know how things are being done. And I've heard so many times people saying, it's always been there at the back of my head, but I've never got around doing it. Thank you for being here. They take up a form, fill it in, and give it. We've been to libraries, to civic centers, to meetings, to melas, to anywhere and everywhere where people would have us. So that is how you need to get into the communities. You need to have either have access to, people allowing you to do it, or just be enthusiastic or passionate enough to find places where they will have you and allow you to talk about this, or to just be there so that people can come and ask you, what is it that you are doing? Why are you here? What is organ donation? And there are people where I have met with point-blank hostility. Why are you even here? You should not be in this place. Because it's not me that they are against, it's the thought. They don't want to talk about organ donation, so they don't want you there. But the more and more number of people trying to go into communities and talk about it, the more we will be able to reach people. And most people, it's about not being aware. It's more about education rather than about beliefs and I know there is taboos and beliefs and things about religion and all that, but more and more people, it's about education. It's about knowing what it is and why it is needed, and how desperate the need is for, especially for people from the BAME community.
Yeah, great. Thank you very much. Mindful of time, can we take maybe 2 more on this section? So, gentleman at the front here.
I'm Manhar Mehta. I'm chair of Vanik Council, which is a community organization, mainly Jains, and some of us are Hindus. We have been recently raising awareness, taking up NHSBT project via NBTA for last couple of years. We are trying to raise awareness within our community to live donations, particularly at this moment in time. And the way we are doing it is to give them insight into kidney problems. We get consultants and live kidney donors, coordinators, etc., and GPs to come in and give talks so that people know what are the problems of kidney, why that problems occur, and how that can be resolved. We encourage people to give live donation. At the same time, we encourage people to donate after death. And as a community leader, I come across a lot of people who have, at the end of the time and last phase of their, or at the end of their life, their family have decided to donate, and they are too late to donate. So it is necessary to educate people that if they want to donate at the end of life, that their family should take a decision earlier. At the same time, I would suggest that people like you on health committee, you can discuss with education committee. One of my colleagues has raised the issue that has given me a suggestion to say that if a subject of this kind of subject is taken up in school, when children are taught about the issues related to life-threatening diseases and the answer to that, then that would help. My community, as our effort to educate a community, we are holding a lot of talks around the country. And I have got a couple of people here who are kidney ambassadors. Mr. Kilmody, who spoke a little earlier, he has helped us in propagating this within our community. At the end of the talks that we organize, a lot of people come in to us saying that although we knew that there are problems, we know of people who have got problems, kidney problems, who go on dialysis. But what happens is, when we listen to this problem from our colleagues, community members, our relatives, we simply just say, this person is in has got one disease and he's not well. But it doesn't occur to us that what are the options for helping this person. Yeah. So it's raising awareness like what we are doing does give people an idea of what are the alternatives, what can we do to help people who are in problem. And as I say, a lot of people come to me at the end of the talks that it is first time that we have realized the seriousness of this issue. And what I am saying that this is, this should be encouraged further within the community, and other communities should be able to give, given chance to understand the problem. I'm thankful to the lady who has spoken here, selflessly raising the issue within the community. Thank you very much.
Thank you.
Thanks.
Thank you. I'm going to go to the lady that's been waving in the audience just back there.
So my name's Natasha. Kirit mentioned me earlier. I've met a few people in this room, so I've been quite fortunate. Some of the things that I wanted to talk around, the struggles that I've had within the community. So I have been a live donor recipient from my mum. That's fine. That's, it is what it is. But from that, I think myself and my family wanted to talk about it to other people. From a less selfish perspective, because I wouldn't want people to go through some of the struggles I went through. I got told I needed dialysis and a transplant, but I didn't have any information. So if you're not giving the information, it's very hard to then share it with other people, and in turn it becomes really hard for your family, your friends, the people in your community to then talk to each other about it. I've been fortunate to have some literature and things like that, but that's solely because Kidney Research UK have sent it to me, Kirit has sent some to me, and it's great stuff. It's out here as well, the leaflets that are in different languages, they talk about different faiths. That's great, but it's not easily accessible to everyone. And I know that was mentioned by the lady at the front, but it makes it really difficult. I'm really passionate about it. It's something that I want to talk about, but then I don't have the material to sort of back it up or let me have a conversation with you. And I'm not asking you to register now, but let me give you some information that you can take away some food for thought. But I don't have access to it, which means a lot of other people in this room and probably outside also don't have access to it. So as Kirit said, I was really, really lucky in that my mum was able to produce a song with a very famous singer in India, and that has then meant that she can take my story and our conversation global. The thing with that is he has a very big platform. When he's doing interviews about his songs and his videos and movies, he can talk about my journey and why it's important to him. I wouldn't come across that every day. So we've got a video now that's got 1 million views on YouTube. That's potentially 1 million conversations that we could be having just because he's talked about why he's done it. But not everyone has access to that. And it's really hard when there's lots of little groups and everyone's trying to make a contribution and talk, but we don't have the right platform, I don't think. I don't think it's made easy for us. There's things like funding that I know has come up with a lot of people here. We all do it off our own backs. But it's hard, we don't have the right place. I was really fortunate for Organ Donation week. I was able to hold a conference in the Houses of Commons, and we had a lot of people sign up off the back of that. We had a lot of other people talk. I know Ari's dad came down. And it made a really big impact because people within our community were able to see real-life case studies. We had other artists, and a lot of people signed up, but I don't have the ability or a place to go to hold something like that all the time. My council don't offer anything like that for me to go and say, do you know what, I'd really like to do this and invite people within my community. And to be honest, my mum and I have tried to get through the door. They just sort of direct you, do you want to call this telephone number and we'll transfer you. It's just not made easy. And I think that's really hard in terms of what everyone here is trying to do. There's so many barriers and blocks that sometimes you feel a little bit deflated. And the other thing I found that, with some of the people here, we've gone to like other functions, like the lady here was saying, and you hold a stand and we'll use the leaflets and we'll talk to people. But the number one thing I find is, again, these sort of stories you find. So I'm Indian, a lot of the people that I talk to, or my grandparents, have heard stories about, back home, they harvest your organs or they freeze them, they do this, that and the other. But they're the sort of people that you really need to be talking to. So ever since I was small, I knew my mum and dad had signed up, as Ari's mum did when they got their driver's license. So in my house it was very common, but my mum's one of 6, and all of her other siblings and their children have never talked about it. So it's, if we're not getting to the heart of the family, I think the BAME community, that we hold our grandparents, parents very, very highly. You take everything they say as gospel. And if we're not getting through to these people, so whether it's literature in their own language that they can understand or somewhere where we can sit and talk about it, I just don't know if the message is really going to feed down. And they're the people I think we sort of miss out sometimes.
Great. No, and that's a really, really valuable contribution and very true within the BME community. And I think something that Orin touched on earlier, it's about how we, in terms of working with the community, I think a lot more needs to be done in terms of going out to them where they are. So, like I said, I represent Lambeth and Southwark. On any given Saturday, most of the hair salons will be packed and most of the barbers will be packed in Brixton and Peckham. On Sunday, you literally walk down Old Kent Road, the amount of churches where, again, there are so many people. So it's about how we tap in and go into those people as opposed to waiting for them to go to the NHS to sign up. So a lot more work needs to be done, and we need to continue that conversation in terms of working with all our different communities. Thank you.
Okay. Thank you, Flo, for that. Just to remind you that if you are tweeting, use the hashtag BME Donor and also hashtag Assembly Health. We're going to move on to the section on looking at the big picture, but I was going to ask one contribution from Natasha Chug, who's done research on the various communities living in the United Kingdom, on the problems facing them. So just a very short, is she here? Yeah, sorry, yes. Do come and to give us a sort of a platform to the next section. Do you?
My name is Nishtha Chugh. I'm a development journalist, and I'll keep it short. In 2016, I won a Winston Churchill Fellowship that allowed me to research ethnic minority organ donation practices in 10 cities across 4 countries, the US, India, Israel, and Qatar. It took me 2 years to write a 20,000-word report on what I found. While I discovered a lot about organ donation rates and attitudes in these 4 countries, there are 3 practical ideas I would like to briefly touch upon today. Things that we urgently need to consider if we want to see better BAME organ donation rates. Number 1, in the US, Black people were at the bottom of the organ donation charts 30 years ago. They didn't believe in organ donation. They didn't trust the doctors for historical reasons. But in 2010, they became the top ethnicity group with the highest number of donations per million, more than whites, Hispanics, or Asians. How did that happen? The answer lay in community engagement. They let the community take the ownership of the problem. So there was a problem with the community, and they went back to the community. They first recognized and accepted this was a huge problem. Then they were empowered to take action through rigorous community engagement and public education programs. It didn't happen overnight. It took 3 decades, but it happened. They also focused on behavior change more than just creating awareness. Awareness serves no purpose unless it leads to change in behavior and attitudes. Number 2, Qatar and India use the power of public recognition of donors and families. Recognizing their bravery and noble acts publicly and in media after they have made that decision does more than awareness programs alone. I have spent the last 2.5 years conducting this research, and I had no idea about Ari's example or about Ari's story. So these stories need to come out, need to be highlighted. They send out an extremely powerful message. It shows respect, it highlights positive stories. People remember positive stories. They discuss it over their dinner tables. 3, London is one of the greatest cultural hubs in the world. Every year, hundreds of celebrities, movie stars, sportsmen from countries like India, Pakistan, Nigeria, the Caribbean, come to London. Why aren't we harnessing their power? When Angelina Jolie comes here and talks about violence against women, the whole world listens to her. Why can't we get the Angelina Jolie of India, or Pakistan, or Nigeria to endorse organ donation publicly? Do you know how many followers Priyanka Chopra has on Twitter? Any guesses? 24 million. Now imagine if she were to tweet about organ donation, if she were to tweet about one family, about Ari or someone from here, can you believe the impact? Can you believe the impact? Can you imagine one tweet, just one tweet from Priyanka Chopra can do to create awareness? Just one tweet has the power to start thousands of conversations over your dinner table. These are some of many, many ideas that are being put to practice in countries like the US, India, Qatar, and Israel. They are presented in detail and backed with evidence in this Churchill report, which shows, yes, it is possible to save lives. Yes, it is possible to change attitudes. From my research, I know these policy changes and these practical steps are being taken and they're changing lives. So why can't we make the same change, go for the same change in the UK? Why can't the UK think out of the box? This report and my recommendations have been shared with the Health Secretary, the NHS, the Department of Health, Jeremy Hunt before he became the Foreign Secretary. But I sense a great deal of reluctance because this report and the things that are happening in these 4 countries that I visited are radical changes, are examples of radical thinking. But I believe London has a wonderful opportunity today through this conference to lead the way. Thank you.
Thank you, Nishita, for this. And now you can share this also with the London Assembly Health Committee. So we look for receiving that. Over to you. Great. Yeah.
Thank you. And I want to just thank everyone for their personal stories. I know it's often very difficult to share, but actually they've been very inspirational. And so I think I've been really heartened today by what I've heard. And what I've also heard is issues about funding, about that sustained community involvement, and about peers sending the message to peers and within communities. So going forward, I'm interested particularly as to examples where things are working well, where things are joined up, so that we can perhaps learn from them. Does anyone have any examples? I've got a few hands. I'm going to go to the lady in the pink and the lady in the orange first. Thank you.
My name is Katie Portal. I'm with NHS Blood and Transplant, the Organ Donation Ambassador Coordinator. So I'm building a national volunteer scheme to help promote donation throughout the UK. You've already met many of the organ donation ambassadors who've shared their story, and so I'd like to share just a few of what we have found successful already with the ambassador program. And obviously this is not the only volunteer or ambassador program. There are so many people in this room doing exactly this. Just reiterating, absolutely, members of communities speaking to members of their own community with their stories, or even not necessarily with a personal story, but with a passion and with information, goes very far. And there is, for those in the room and those beyond, the Promoting Donation Hub on the NHSBT website has key statistics, digital materials, ways to order leaflets, and kind of that empowerment. So taking that one step beyond, the organ donation ambassadors have training, but what they really bring to the table is access to their communities. Some of the most successful events so far have been our ambassadors going to their own faith communities, highlighting or identifying a large event, a lunch or a temple event or a community event where everyone is gathered, everyone knows everyone, it's one massive family, and everyone's relaxed and open to having conversations. So you don't just have one person coming up to the table, you have a whole families coming up to the table, and you have ambassadors with personal stories, with the correct information, sharing that information and saying, well, why aren't you signed up? Why haven't you talked about this? So we have had some great success with actually asking our ambassadors to open those doors. In terms of the question as to where the conversation should start, I would agree with several people in this room, and our ambassadors have found great engagement in schools. And in fact, every time I've gone into a school, every time I've ever been stumped by a question on organ donation, it's always been a child, because children have such a fascinating desire to learn. It's a fascinating subject to them. I myself am a recipient, and my donor was a child. He died at 8.5 years old, but he made his donation decision when he was 5 or 6 years old, when they had a family discussion after a news story on the telly, and he told his mom, well, I want to donate a kidney because I only need one. He was fascinated by it. If he hadn't said that, I wouldn't be alive today. So children have this incredible curiosity, and if we're looking at changing the culture, it has to start young. We're looking at Jay and Sina's twins. They are already organ donors. They're growing up in this culture of positivity. And the final comment I would make on behalf of one of my ambassadors, Sheila, who isn't here today, she's part of the Gujarati community in kind of northwest London. And she said to me, Katie, I try and think about my mum. How would we share this information with someone like my mum, who does speak English, though maybe not very confidently, but is, an active member of the community, a massive, family. And Sheila is a donor daughter. They lost her father, so they have been touched personally. But with her mum, she said, if someone doesn't listen to mainstream media, if someone doesn't read mainstream newspapers, where are these other community, local newspapers or local blogs or local Twitter kind of, channels? Where are these very bespoke, localized, and to your point as well about breaking down the backgrounds of the communities? I think my question is, how can we not only have a larger scale awareness, but also some really bespoke grassroots? So we've found those successes in the Organ Donation Ambassador Program so far, and hope that can only grow, and I hope that feedback does help.
Thank you. And the lady in the orange here, then I'll go to the lady at the back over there. Thank you.
Hello, my name is Ella Vine. I'm the Chief Operating Officer at the Global Kidney Foundation. We are a UK-based charity, and that's the same charity Zahid Bati was talking about when he was giving example of his story. And a couple of things I just wanted to briefly talk about. First idea that we can put forward for all the others and for you as well in London is that we are piloting a new project now with the support of NHSBT, and it is about giving free health checks by nurses. So we will be doing free blood pressure and blood sugar health checks, and at the same time the nurses who are trained in talking about organ donation, at the same time they will be talking to people and encouraging them to sign up to be a organ donor. So it's about doing it a little bit in a different way, not just only going to community events and having a stall and talking only about organ donation, because it's not an easy subject and people don't always want to talk about it, they want to skip it. But if they are having kind of giving something for free, like a free health check, and at the same time the time is being used to talk about organ donation, so these are like different ways of doing things, and this can be done in any other setting. Does not have to be health connected, it could be anything else. And another issue that we're touching on, what the researcher was talking about earlier, late last year we did an event that was very successful in London, and we've invited some celebrities. So in one room we had a mix of few countries. We also had international actresses, we had some fashion designers, business people, and we got all of them together, and that's when we raised awareness of organ donation, and we will be doing these events every year. No Angelina Jolie yet, but we're working on it. So this definitely, it's a scope to raise awareness, and we also go every month, we go to different business galas and business events, nothing to do with health, nothing to do with organ donation, but that's where we raise awareness. We go on stage and we raise awareness amongst leaders who can then raise awareness amongst their employees and wherever they are leaders. So these are ways of, there's a big impact of doing it that way. Thank you.
Thank you. And there's a lady on the back row. Thanks.
Good afternoon. My name is Akshaya, and my colleague Pravar and I, we represent the National Hindu Students Forum UK. And the topic that we would really like to discuss is where it is important to start conversation about organ donation. And our focus primarily lies in a place not actually mentioned here, but university campuses. So we are in our 27th year and currently are affiliated to close to 50 universities spanning across the country. And we, through various events, initiatives, and campaigns, we really engage with students, connecting current social issues to our values. And following on the topic of organ donation, we ran the National Donation Month campaign earlier in November, where we were able to engage with students at a local and national level to talk about and raise awareness on different forms of donation, including organ, stem cell, and blood donation. In our national sports competition, we were privileged to have representatives from the South Asian Health Action come and help us raise awareness. And that dominoed in turn where we had students across 17 universities raising awareness for organ donation at their local university campuses. We're also privileged to be a part of the steering group led by Kirit Modi ji, where representatives from different Hindu and Jain organizations are coming together to encourage conversation, and we really hope to provide the youth perspective, because we believe that youth form the future of the society, and hence are the pillars to engage, champion, and change the current narrative that we're in. Through the work that we're currently doing, we face the challenge that students face the challenge of being unable to articulate the importance of organ donation, as well as how it leads to their current value system, and in this case, the dharmic values or the Hindu values of selfless service or giving back. We are hoping that through connecting with various organizations over here who have provided such inspiring stories, we can really come together in the form of either support, resources, easy access to resources, and really help our students articulate why it is important to engage in organ donation, because organ donation is an issue not limited to age, and it can affect our generation. as well. So we're very thankful to be here today, but also hope to continue to build on sustainable collaborations and partnerships, and are really keen to work with as many people here as possible to help get the word across in the student community.
Okay, thank you. Then there's the lady in front with the green scarf. Yeah. Or the green top. Yes, you. Yeah.
We work together. So.
Hi, I'm Leah Jane. Because hopefully it's an example of true cross-working. We at Kidney Research UK, we're a national charity, but we've been developing a peer educator program. It's basically exactly what some of us have been talking about today. It's ensuring the right message is delivered by the right messenger. So this has been about 10 years ago. We first started in northwest London, working with Professor Warrens from then Hammersmith Hospital. And essentially, it's a model whereby people from the target community, the people from the community you want to reach, who are passionate about giving back to that community in terms of health information and organ donation messages, they are trained. We provide an accredited training program. They're trained, they're supported with materials, resources, pop-up banners, information in different languages, and they go out into the heart of their community. Some of this has already been mentioned. Katie mentioned as well that anywhere and everywhere they can go, from an Asian bridal fair to a local library, to shopping centres, to a more private venue, etc. Also the lady here from Global Kidney Foundation mentioned the attraction of getting a health check. We've been checking people's blood pressure. You'll be amazed how many people want their blood pressure taken, and they'll come along, and in that uninterrupted minute or so, you can actually pass on some really useful information to them. So we've been doing that as a national charity. A lot of our work has been in various parts of London, but we've been commissioned by the Scottish Government to work there, and we are now in the 5th year. It originally started off as a 1-year programme, but it's been so successful they are now commissioning us for a 5th year. So it would be really wonderful to see other governments doing this as well. The work in Birmingham involved raising awareness amongst one of the hardest to reach groups, the Pakistani Muslim community, where we talked about organ donation as well as stem cell donation. And at the end of that project, over 1,000 people joined, as well as the wholehearted commitment of imams who helped raise awareness within their mosques at Friday prayers. And that, they are really the key messengers, because as a result of that, we were having people not debating and arguing with us. They were coming out of the mosque saying, where do we sign? So as an example, I've talked far too much, but as an example of this, we have Surma, who is a peer educator here in Tower Hamlets. We started the project with some seed funding from the Department of Health for a year. It is an evidence-based program. The peer educator model has been independently evaluated, so it worked, it's been shown to work, and then our work is carried on from that. But the issue is we're all doing pockets of work, but it's how do we sustain it? So I want to pass on to Brenda from Tower Hamlets Public Health to show how we've been working together.
Yeah, hi. So I'm Brenda Scotland. I'm from Tower Hamlets Public Health. When Nurja approached me a couple of years ago and explained the project and the work that she was doing, I was very keen to support her. And within public health, we looked at how we could do that, and we do a lot of work with communities. So what we've done is utilise the networks and the connections that we have in our communities with those hard-to-reach communities, individuals that know, the community connectors that know where to go and know where the best places are to speak to people, but also using our connections with other services like our libraries and our learning services and our schools and our colleges to get Surma and the peer educators into the right places to really start to talk to people and engage people just in the conversation. Also using our employment like our town hall and our other council offices to just raise awareness amongst our staff, amongst our communities and amongst our young people as well. So we're working very closely. We've funded the project for another year because we can see the potential and the scope that it has to reach people, and hopefully this is going to lead to a strategy within the council itself that we can develop in terms of how can we approach and work with the issue of organ donation.
Sorry, can I just correct the terminology? It's not hard to reach, which is easy that's what it's about, because we pose more challenges and more resources need to be tried. So
Okay.
just mindful about it. We're not hard to reach.
So yeah, it's not hard to reach. It's us who needs to go and find those people in the right places. Like we go to the mosques or libraries. I was thinking of going to a mother and toddler group as well,
Yeah.
anywhere and everywhere. And the thing is, people actually don't know what the process is after organ donation. And sometimes they will say, well, you know, religiously we're not allowed. And at that time I will say, well, can you point to me in the religious scripture where it says you can't donate your organs? And they do think about it. So one of the things I love about this project is you choose someone who is from that community, who knows that community, and can speak the way that they want, you know, they need to hear. I mean, imagine if I was just a white person going into a Bengali Muslim community. They'd be like, I don't want to hear you, what are you saying? And a lot of people have said to me, it's so refreshing to see an Asian woman from our background talking about this, and they won't question you if you do question the religious arguments that they give, and if you question them, they won't question you because you're from that community, and that helped a lot. And you know, in the beginning it was very, very tough, but we still went to the same places every time, and now people have softened up, and you know, people are accepting, and that's what I've noticed from the project that we're doing right now. Thank you.
Hey, Joe, I think we need to call this to an end. Yeah, I'm very conscious of the fact that we are overrunning. Pardon? Oh yes, but hang on. We need to give a 5-minute break to our interpreter because her hands are getting tired. So I want to give her a break. I want to take a 5-minute break. We're going to come back for the last section by Assembly Member Andrew. And then, right, we're going to wrap this up by 5 o'clock. But there is still the opportunity for you to write to us. We are open to take evidence and to hear from you. And I'll give you a follow-up of how we are planning to take this forward also. So this is not the only conversation. This is the beginning of conversation we're having in the months and years to come. So let's have a 5-minute break. Thanks.
switch off. So we had half an hour before we were dripping.
Thank you. I'm going to ask my colleague, Assemblymember Andrew Boff, to start looking at the role of the healthcare professionals in the organ transplantation service and how we can involve. So I'm going to leave it over to Andrew to take on the next section. Thanks, Andrew.
Thank you very much. And can I just thank everyone who's made a contribution so far, because it really has been an eye-opener, and especially to hear such personal testimony from people who really know what they're talking about is really valuable for us as a health committee to try and move forward and try and make a positive difference to people's lives. A lot of what I wanted to ask questions about has already been answered, and you've been very forthcoming in answering some of those questions, because I particularly want to address healthcare professionals. We've heard a lot here about how the lack of information for those people who've been diagnosed as needing an organ, how that has affected and been a problem, and that's something we're very much going to write up on and do something about. We've heard about how we have to work within communities rather than just, or whether those communities should be encouraged to work amongst themselves. Actually, language is very important in this area, and that or give resources to those communities to work within themselves. But I particularly want to hear from those healthcare professionals who can suggest what needs to happen to improve the situation. You know, we've heard a lot about survey respondents believe that being an organ donor, for example, will negatively affect the quality of their end-of-life treatment. We've heard that a small majority didn't realise that diabetes was a factor in organ donation. Now, obviously, this is something that needs to be addressed, but I want to hear from those healthcare professionals where you've got positive stories, if I can. So, you know, if somebody can stick their hand up and say, from a professional's point of view, what seems to have worked? Sarah at the back there.
I'm Raj Thurasingham. I'm a kidney doctor at the Royal London Hospital. I'm not a surgeon, I'm a physician, so I'm involved with working up patients who are going to have a transplant, looking after them afterwards, and working up kidney donors. I think Tower Hamlets, we're lucky. We've got a project that's working, as you've heard. I'd like to challenge maybe the Assembly on a couple of issues, which hopefully you could help us with. And thirdly, want to raise an issue that I come across in our local community that perhaps, again, I can challenge you to try and address. Firstly, I think I would endorse what many people have said before about celebrities. And if we get celebrities to endorse organ donation, that would be very helpful. We have someone who works in this building who is a very prominent Asian Muslim person in London, Sadiq Khan. You know, if he could be an ambassador, if he could be photographed for publicity with him being on the donor register, something like that will have a very major impact, I think. London is awash with celebrities, as we know, and we've got football teams, we've got all sorts of things that, and with very prominent people from the Black and Asian communities, and I think if we can engage with them, that would be very helpful. The second thing I'd like to perhaps challenge a little bit is, again, what's happening with Tower Hamlets. We are working in Tower Hamlets, public health has taken this on as an issue and are going to come up with a strategy about organ donation, and maybe local councils can become accountable for at least numbers of patients, numbers of people registered on the organ donor register. If someone had set targets, that we can publish their results, local government can compare to see how people are doing. And there, I think, will raise awareness, at least in local government. We certainly in Tower Hamlets know that we had numbers of people registered on the donor register as being lower than our neighboring Newham. So that's an incentive. That's the challenge we've taken on. the local government, not we as a hospital, the local government, but working in partnership with us in the hospital, has taken on as a target to try and achieve. And if all...
Can I just ask you, are those figures easily available, the comparison between different
Yes,
boroughs?
I think, yes, I gather they are available. So that's something very simple that can be done. So those are the two challenges perhaps to you as an assembly, but the problem that I want to address is with living donation. These are issues to discuss deceased donation. With living donation, we have a particular problem in our local community of patients unwilling to ask or accept kidneys from their donors, potential donors in the UK, be it sons, daughters, brothers, sisters, but are quite willing to accept donors from abroad who are family members coming from abroad. This I've come across. I work up the donors, and I've come across this on a number of occasions where family father, mother needs a kidney, the children are either unwilling or the parents, more likely, the parents are unwilling to let their children donate. I think we're seeing a generational change in that children now of these communities are willing to donate, but their parents aren't willing to accept, but are quite happy to accept a donor from a distant family member abroad, from a country, say, for example, I work with a lot of Bangladeshi patients, so from a patient, from a donor from Bangladesh, a relative from Bangladesh. So they're willing to accept that, but not, and that poses a very difficult challenge for us as professionals, because you can't, if somebody's not willing to accept a kidney from a donor, we can't force them, of course, but if they're saying we've got someone abroad who's very happy to donate, we're told, I would rather, they want to donate, they're willing to, I'm willing to accept that kidney. How do we, there's nothing legally to stop us that happening, because if they're willing and the recipient is willing to accept, it can go ahead. And that proves quite a difficult ethical challenge for us on numerous occasions that we've come up with that. So some sort of guidance or some sort of view on that is complex, but again, that's something that perhaps I can challenge with some guidance, perhaps, at least in London, we can take a view on that.
Okay, thank you very much for that. Thank you. Who else wanted to indicate?
Can we have a mic here, please?
Oh, yeah, can we have a mic there? I beg your pardon, sorry, I didn't indicate. It's my fault.
So I'm a nephrologist from St George's Hospital, southwest London, which is in the depth of diversity in terms of ethnicity. And I can understand that scenario of being the only one, because for a long time I was the only female black nephrologist in the entire United Kingdom. Now, I echo a lot of what my colleague Raj has said, but there are some little things that I just want to highlight. One, it's amazingly exciting hearing so many people from so many different walks of lives talking about kidney donation. What would help to come out from this meeting is if all those that are in this room today could actually have a list of all the others that have been here today and contact details in order to form some kind of internal forum, because there's a hodgepodge of availability of information. Some people seem to have more and some people seem to have less. Another thing I want to emphasize is what we've noticed is patients working together works very well. So institutes where they have a kidney patient website, that works well. What just needs to happen is we need to be very clear about the information that is going into these sites and that is provided to communities, patients, and families. A third thing I want to emphasize is it's extremely important we reach all generations. I was glad to hear about someone talking about grandparents, but also, or the lady's gone in the hijab, in terms of the fact that we have so many young people with kidney disease. One of the reasons why it's getting more common is because we're getting much better with our medicine. We're having more and more women having children at older ages, and similarly men as well. We're having more premature children who are living longer. So where seeing kidney disease in young people was rare, it's becoming increasingly common. So we do need to reach into the schools, the colleges, and the universities to spread it to all the generations. And maybe the last point, I have many, but I think just if I leave you with 4. There is the scenario, who is the best messenger? It's not necessarily the individual with the kidney disease, it's not necessarily the family, it's not necessarily the healthcare professionals. To be honest, it's every single person in the room. We want to make the awareness of kidney disease so common that it's like brushing your teeth. Everybody's talking about it. And that way, when people have the kidney disease and they need to approach their family about it, seeking who will be their donor, it's not going to be heard of for the first time. Put it on EastEnders, it's been on there already. Put it on Coronation Street, it's been on there already. Let's make it public. I'll stop there.
Thank you. Thank you very much. Are there any other contributions on this, madam?
Hello, my name is Hasha Jani. I want to speak essentially about changing the mindset of the food industry as well, because yes, some of the kidney diseases are predisposition, some of them are congenital diseases. However, we know that kidney diseases, organ failures are at an epidemic proportion in this country. Now, the food industry is slightly responsible for this. There are just so many preservatives, pesticides, colorings, etc. in the food that we eat. And I think there needs to be a conversation of the health industry and the food industry to see where we are going. I think this is absolutely essential and absolutely vital that we move along this pathway. My second quick point is that when after a person receives a kidney, the recipient should be advised about what is the holistic approach to keeping the kidney healthy. A lifestyle change, a change in the food eaten, a holistic approach is really vital. And I think on the websites, in the general social media, this needs to be discussed as well, that post surgical procedure, that there are certain elements where an approach to eating healthy, good lifestyle changes are vital in keeping those organs functioning well. Thank you.
Thank you very much. Are there any other contributions? If not, I'm going to... yes. Thank you.
Hello, it was Fiona Loud again. It was just one comment about the health professionals, just to kind of prompt thoughts. Every single hospital in this country has an organ donation committee. So this is not to do with the recipients, it's to do with the donors. And that receives some funding from NHSBT. Many people who are part of that, there will be a lay chair. I'm a lay chair of my local committee. And it is supported by a clinician who is usually an A&E or an intensive care expert. There'll be the local coroner for the county who'll be linked in with that, and there'll be a whole range of other healthcare professionals from the hospital. And their role is to make organ donation normal. So I know we talked a lot about kidneys, but this is about, of course, this is about all organs. So they are implanted, not implanted, they volunteer to be part of the committee to do that locally, to look at every single opportunity there is to involve donors, to be able to honour the wishes of a donor, to be able to work with the specialist nurse coordinators to identify patients who are dying and for whom there may be no chance of recovery. And that is part of a local community. So I think there's an opportunity there. So there'll be many, many hospitals here in London. Well, there are. I know there are many in London who already have that resource, who will then pick up and use national opportunities like Organ Donation Week, which is in September, World Kidney Day. I know we're talking a lot about kidneys, but that happens to be in March. And they are there, they can work with their local volunteers, they can work with their local kidney patient associations to run local events that can work in the local communities. And we, as kidney charities, so us with Kidney Care UK and the other kidney charities who are mentioned here today, we collaborate every year to produce national messages that are available to everybody to use, and then to take those messages out into the communities in different ways. But I just wanted to make you aware of that resource that perhaps people haven't been aware of.
Very much. And I'm afraid it may have to be the last contribution, I think, from the lady behind. So, okay. Yeah.
Thank you. I'm Kirit Modi, and I'm a founding member of NBTA. Now I want to give you an example of how communities have worked effectively with local health professionals, yes, to give you a flavor of it. And the project I'm going to be talking about is again, we talked about funding, but not much about whether that's happening. I've been involved in this for many years, as many of you in the audience know. But I'm more optimistic now than I have been for a very long time about organ donation. And there are two main reasons. The first one is that at last, England is following the footsteps of Wales and hopefully Scotland and so on in trying to get deemed consent on the books. And therefore, there'll be a massive campaign to explain what deemed consent is and so on. And I think that potentially could be a game changer. But the other thing is, we've talked about funding, and we've been through NBTA and others have been talking about things, saying that the message has to come from the community. So the communities, a lot of good work is done on a voluntary basis, but you do need relatively small amounts of funding to support that. And we've been arguing for that for a very long time. And I'm pleased to say that the Department of Health and NHSBT have at last started that process. And I want to give you two examples. The first one is a living transplant initiative. And this is funding which is for 2 years, small amounts of funding, and we announced this for people to bid for that funding, and now we have currently 8 projects running aimed at the BAME community in increasing living kidney donation. And 4 of those projects are in London. So we've got Manubhai Mehta, who talked about his project. We're aiming at the Jain community here. We had Della, who was talking about the black community. So we got those 2 projects. We've got one for the Hindu community, and the other one is there's another project for the black community. So 4 projects on living donation are happening now with relatively small amounts of funding, but that funding is coming through. The second thing about funding is using the experience of Living Transplant Initiative, we managed to persuade the Department of Health to say, you need to do more. What about donation after death? So they started what's called a community investment scheme, which was announced last year. And a number of you here know about this and so on. So there was a national advert to say bid for funding, and we had 40 groups across the country who bid for that funding. There was a rigorous evaluation process, and 26 projects have just started now on that. So just on the funding thing, I think it has started, but we don't want it to be short-term funding. So something for the Assembly to consider is to say, let's make sure that funding like this, and we're talking about, if I give you an idea, I think funding for the Community Investment Scheme is something in the order of £150,000 nationally. So we're not talking about huge amounts of funding. Yeah? But that sort of funding needs to continue year on year with evaluating projects and giving more people opportunities to bid. Where the hospitals come in here, that you can't do this work alone. While the community can lead it, it has got the outreach out there, it can have peer educators, it can have a range of people and so on. The community does not always have the expertise which is in the hospital. So whether they're nephrologists or living donor coordinators or specialist nurse for organ donation, these are the people who are on the ground doing this work day in, day out. So what we've found is in hospitals like Hammersmith, and I think St. George's is involved in this, and Roll Free and others, we're engaging with those professionals. And because we're working with the community, most of these events take place either in the evenings or more probably over weekends and so on. And what we've found is that there's been a great deal of positive support from the health professionals like yourselves and others. So I think there's an open door there in a sense. So what I think a message for you is to recognize first what the health professionals are doing for our community, but secondly to encourage them, and I think to spread that right across London.
Thank you very much. And as a politician, I'm used to being unpopular because I'm going to finish it there, I'm afraid. I'm so sorry.
Thank you.
I'll hand that back to the Chief. Thank you. And I apologise to the lady.
We do need to bring this together because all four of us have commitments elsewhere also. But look, first of all, let me thank you very much for all of you taking your time and effort coming this afternoon and sharing your experiences. We've had very powerful testimonies here. We've had very powerful stories and very great examples of the good work going on, and we just need to bring this all together for much more impact. I also can tell you that on the 7th of February, the Mayor, Sri Khan, will be doing an event with the blood transfusion and transplantation service here at City Hall. So we will be getting him behind this campaign and this. Whether he signs up on the card there or not, I don't know, but he certainly is doing a big event with the blood transfusion, and this will certainly raise the profile. And just to also put in your diary, the evening of March the 18th, we're going to do a big drive, a big media drive with artists, with the performers in the evening of March 18th to get organ transplantation much more on the London map. So we are doing a big follow-up event on this. So get that into your diaries also, please. And don't forget that you can always write to us. We're open to suggestions. We're open to ideas. This is the end of a meeting, but not the end of the consultation process. So please do write to us. And thank you very much for coming this evening. Have safe journeys home. Thank you.
Thank you. Thank you very much.
GLA Chamber South.